I'm Erik Botker, Professor of Cardiology in Aarhus, Denmark. I attended the ESC meeting 2015 and a session about usefulness of guidelines for treating difficult patients. Together with me, I have Professor Sigrun Halvorsen from Oslo, Norway, and Professor Alonso from London, UK. And Angeles, who is actually the difficult patient?
Wow, good question. We have really difficult patients, and I would summarize saying that the difficult patients are the real-life patients. Those patients that we see in our day-to-day practice, which means those patients that are older, those patients that have comorbidities, and those patients that we really don't know the answer how to treat them for a specific and long condition.
Yeah.
Sometimes also two conditions at the same time, and more comorbidities, and then makes it more difficult for us to choose the best treatment.
Do the guidelines help us when we have to manage this kind of patients?
Yes, I think many of the guidelines, they can give us some help, but it's different from the more standard patient, where we can just go through the lists from the guidelines what to do. Here we have to pick something from one guideline, something from another guideline, and put it together. And maybe in some of the patients we discussed, there were no guidelines at all. And then we have to choose from what we know, from other smaller studies, from common sense, we have to use the art of being a cardiologist to decide how to treat the patient
I fully agree. The guidelines are a tool to the day-to-day practice. They don't give the answer for everybody. No. So we have to employ our knowledge and our common sense in day-to-day practice.
And I also think that this session highlighted the need for at least one more guidelines, for instance, in the field of cardio and oncology, where there's in reality no guideline from the ESC at least. And this is an increasing problem because due to the increasing number of drugs we treat the cancer patients with, that in many cases have a toxic effect on their heart. We need more knowledge on how to treat them, and I think we need a guideline.
Yeah. So what you're really saying is that guidelines are not rules, but they are guidance for the best management of our patients.
Yes.
So what was the really good take-home message from the session that we went to?
I think that the three cases that we have seen in the session today with patient comorbidities were really very, very good presented, and they are really day-to-day cases. So to me, the take-home message is that guidelines help, but we have to use our knowledge and common sense. Second, as Sigrun said, we need guidelines in certain fields, like oncology and heart diseases. And overall, you have to know that guidelines are based in randomized clinical trials, and clinical trials have their own limitations for external validities. So there's a lot of lacks about long-term, short-term, withdrawn studies. So we have to know that guidelines, they don't have all the answers.
Sigrun?
I fully agree with you, but I will also add that I think the session highlighted the need for a multidisciplinary approach to these patients with several diseases at the same time, for instance, both stroke and myocardial infarction and things like that. So we have to collaborate across the boundaries, the usual boundaries, and talk to each other as a multidisciplinary team.
It really emphasized the heart team need.
Yeah, yes. And we could perhaps extend from the heart team, and when we have the very challenging patients, we need to go into a real multidisciplinary team to solve the problems for the patient.
Expanded beyond the traditional heart team in many situations.
Okay, thank you very much. I think I want to summarize now. I think we had a very exciting session about the dilemmas and difficult patients, and do the guidelines really help us? And what you have just heard is that yes, the guidelines help us, but we need to add common sense and use our knowledge in combination with the guidelines. So also another approach that we should take when we take the really challenging and difficult patients is that we should use a multidisciplinary approach really to give the best treatment to our patients. Thank you very much for your attention. Thank you very much for your coming.
Pleasure.
Thank you very much.